Welcome. Welcome, everybody. It is indeed our pleasure to host this side event, Education and Health Are Human Rights. Initiatives of Women's Health and Education Center, its acronym is WHEC. Its focus is on education for all and health for all. And its global digital platform, womenshealthsection.com, was launched on 24th October 2002 in collaboration with the United Nations, WHO, and we have speakers of WHO today here with us, and UNESCO. Our advocacy initiatives are accessible in 227 countries and territories, and we serve about 10 to 12 million people around the world every year. We have very talented group of speakers today who will elaborate various challenges and solutions in achieving health and education for all. Please feel free to contact the speakers directly or put your questions in the chat box. We shall be happy to take some questions at the end of this session. Let's start my presentation. The aim of this side event is to understand the potential of social and economic impacts that quality education and improved health can bring in achieving peaceful coexistence for policymakers and the individuals alike. This means planning for the future and working together. Initiatives of WHEC are hard at work for the last 23 years to achieve education and health for all. It is at the heart of our projects and programs to focus on eliminating poverty, hunger, and achieving all the Sustainable Development Goals, SDGs. About us. Here is a brief summary and brief history, and the link is provided to you to see and read in detail. WHEC was established in 2001 in Western Massachusetts to undertake various projects and programs with the United Nations, WHO, and UNESCO, and other academic institutions from all over the world to advance this mission. The precious knowledge that touches patients and general public is the contribution of various iconic institutions from USA and many other countries. As the practice of medicine evolves, so does the WHEC practice bulletins. Link has been provided to you and you can read the details. We welcome everyone. Please feel free to share with us your point of view. Now, what are the main problems? Number one is the digital gap. Digital gap between developed and developing countries and within the countries itself. Least developed countries are falling behind for various economic and social reasons, such as lack of investment in this area by the corporations and the government. The 2030 agenda is based on an interconnected economy, society, and environment. Partnering the SDGs represent a fundamental shift in thinking in international development, recognizing the interconnectedness of prosperous business, a thriving society, and a healthy environment. When it comes to 2030 agenda, this whole world is a one big developing country. Digital gap will be discussed later today by Dr. Meni and Dr. Edith Luhanga, in this session. Number two, cost and the financials. Using global collaborative platforms on education and health can reduce the cost of content development and dissemination in 227 countries and territories. We are grateful to UN, WHO, and UNESCO for their collaborations. Number three, why or usability. Imagine students in developing countries and developed countries simultaneously reviewing the same educational and medical lessons and learning from each other. This e-learning is at its best in an internet classrooms, and by interacting with different cultures, we will be able to understand different customs, cultures, and faiths and learn to respect the diversity. Solutions. Closing the gap. Our years of work and experience and analysis of various projects lessons learned shows most important step is harnessing the digital revolution for the benefit of public education and common good. Digital technologies can also help to close the urban-rural divide in health and education sectors. We aim to mobilize humanity's collective intelligence that involves youth, educators, civil society, governments, businesses, corporations, and stakeholders. There is a rich diversity of ways of knowing, which relies on broad and open access, learn to do and learn to learn. Our digital platform, womenshealthsection.com, is very easy to use. Please review guidelines for the contribution. Our initiatives are unique. Quality education and universal health coverage are the most important investment that any country can make for its future and for its people. Investing in health and education is investing in people and in our collective future. Serving all over the world, this journal, womenshealthsection.com, is is most widely and read platform in the specialty. We plan development together and we build partnerships to last. Please review our best practices network. Link has been provided here. Benefits of WHEC practice bulletins. Launched in 2006, WHEC practice bulletins provides up-to-date overview of the topics. The emphasis on evidence-based medicine has taken on new and the greater importance as the environment of clinical medicine grows more, with increased access to more information by both physicians and the patients, and changing allocations of resources. These practice guidelines are formal synthesis of evidence and developing, and they are developed in according to a rigorous research and review process. We thank our writers and our editors for their excellent work and sharing their expertise with us. Details can be found at the bottom of the slide. Now, what are we looking for? There are no easy or simple solutions to these complex problems. We wish to stimulate discussion and bring to light new approaches to old problems in health development. Rich and poor countries face similar challenges in providing quality education and universal health coverage to their population. This whole world is a developing country. Some have a longer way to go than others. Join us. We welcome everyone. Business model means how do we work or what are the most important steps to get here. In 2008, collaboration with BMHCH, partnership with Maternal, Newborn, and Child Health of WHO Geneva, Switzerland, was established. In 2013, Link Access project to disseminate
मेरा भी काम
reproductive
है
health research worldwide was
मैं
launched.
कल कर रही थी पर आपने बता दिया सुनने
Please,
ओके
please mute your. Thank you. Innovating, networking, or knowledge is the acronym for the link. Our friendship has no boundaries. Please review in detail. Link has been provided for this. Advancing the agenda. We have unique role to play in strengthening in rich and poor countries alike. Health and WHO sectors, we believe on this path, effort never goes to waste and there is no failure. Now, in summary, all over the world, we all provide care to multicultural society. Programs are needed for healthcare professionals to provide them with academic training and practical knowledge to assist them in providing national and international health care. Proceeding in this way and building capacity, preserving the cultural integrity and the access to such technologies for those who need it most must remain the goal. Thank you very much. And the Women's Health and Education Center makes a strong case for a new social contract for health and education for all. Join our efforts. Please feel free to contact me directly if you wish, and feel free to contact any of our speakers directly. Okay. Now, it's my pleasure to hand over the platform to WHO and PM and NCH partnerships for newborn, maternal, newborn, and child health. Go ahead, Baya.
Thank you very much. I'm just trying to share my screen. Just give me a second.
That's okay.
Can you see my screen?
Yes.
Okay, perfect. Thank you so much. I'm actually stepping in for Anshumohan, who's not been able to make it because she was unable to sign in to the meeting. I'm Bhavya. I work at the Partnership for Maternal, Newborn and Child Health as the coordinator for the Adolescents and Youth constituency, and I work on the adolescent wellbeing portfolio of the Partnership for Maternal, Newborn and Child Health. We are hosted by the WHO in Geneva and work as a partnership unit. So there are about 8.1 billion people in the world, and 1.8 billion adolescents and youth exist. And this is one of the main reasons why we also focus on this population, given that it is the largest cohort of young people in history. We have 23% of the world's population are adolescents. Different adolescents and youth face many different issues, cross-sectional issues across the world. Some metrics are given here. I'm not going to go into a very much detail, but happy to share this presentation with the group as well. There is a polycrisis and intersectional vulnerabilities which happen with adolescents and youth. They deal with lack of family, community support, learning crisis, malnutrition, insufficient and appropriate employment opportunities, lack to access of education, and all these kind of come and challenge adolescents and youth in many different ways. So as we move forward and as we were thinking about the adolescent and youth as adolescent wellbeing portfolio, we also wanted to share what the cost of inaction is, why investing in adolescents and youth is very, very important, because if we don't, there is at least 20.5 US trillion dollars that can be lost over the next 12 years. That means that about $1.7 trillion per year. We have taken undertaken a massive portfolio of work for this, and we started with a conceptual definition of what adolescent well-being means. This means that we are going beyond health, and good health and optimum nutrition is just one of the domains of what well-being means. So the definition that we came up with, which was with other H6 partners, was that adolescents thrive and are able to achieve their full potential. And in this, we didn't only include good health and optimum nutrition, but also other domains like agency and resilience, learning, competence, education, skills, employability, safety and supportive environment, and connectedness, resilience, things like that. This was published in the Journal of Adolescent Health in October 2020, and I'm happy to again share the link with everyone once this is done. This slide captures a little bit of what we have been doing since 2019 and how the portfolio has moved forward and how we are trying to address the gap around adolescent well-being and advocate for more partners to come on board and for the world overall to come on board to invest more in adolescent well-being. So in 2019, we launched the call to action for adolescents. We had the conceptual framework for adolescent well-being published. We then started working on an entire portfolio of technical work, which had 15 technical papers, which focused on the 5 domains of adolescent well-being and programming to promote adolescent well-being. And we've also been working with the British Medical Journal to focus on these domains. So these have come out in 2 different bundles, one in March 2023 and one very recently. We also have been working and last year had a global forum for adolescents, which was a milestone in a campaign called the 1.8 billion Young People for Change campaign. The 1.8 number comes from the 1.8 adolescents and youth in the world. And as a part of this, a key milestone was the Global Forum for Adolescents, which had many different partners coming on board and advocating for different issues that adolescents and youth face on a daily basis. As a part of our technical work, we have been working on adolescent well-being investment case. So building an investment case for adolescents. Some of the key programming issues that we focused are on reducing child marriage, mental health prevention and treatment, HPV, education and training, nutrition, traffic accidents, and a cost-benefit ratio has been taken out. And different countries have been modeled to check this particular case. We are also going to be moving forward with pilot testing the investment case in 3 different countries, and that's one of our next steps. The second piece of work, which is connected with the investment case, is also a measurement approach. We're trying to build a measurement approach where indicators specifically for adolescent well-being exists, and this would include well-being indicators, which focus on a small set of available country data that only pertain to key adolescent well-being topics. So with this, we would identify and fill some data gaps. There would be national action indicators, which would report on government level actions to advance adolescent well-being. And then, of course, there would be sector-specific guidance, which would link to specific indicator sets and measurement guidance to support the data collection and use at the national level. When going back to the 1.8 campaign and the Global Forum for Adolescents, one of the key things, the objectives of the forum was to engage partners at a country level and introduce all this work that we have been doing, including the programming work, the investment case, the measurement work, increase awareness about adolescent well-being. So as it relates to data, the knowledge, all the technical work that we've been doing, engage more and more young people. So our ambition was to engage more than 1 million young people and develop an agenda for action for adolescents, which is an advocacy tool for everyone to use to prioritize adolescent well-being and also build strong support and audience around adolescent well-being and demand that it is included and considered to be a very critical part of contributing towards progress towards 2030. This is a quick snapshot of what the forum looked like and what some of the key milestones were. So we managed to reach we had a hashtag 1.8, which managed to reach about 3.5 million people. We had registrants from many different parts of the world. 63.3% of the registrants were women. We had 3 plenaries, about 22 sessions, 130 plus speakers, 117 leading partners, 124 national events that promoted the work of the Global Forum for Adolescents, and many different product launches, innovation spaces, a competition that focused on art that introduced adolescent well-being. And of course, we also had a lot of our partners from constituencies participating in this. As a part of the 1.8 campaign, we also undertook a survey that focused on what young people want. So we actually used an AI-enabled chatbot to go down into different countries and ask young people what they wanted most for their well-being. The responses were anchored in the 5 domains of adolescent well-being, like you can see on the screen. And the most responses that we got of what they want most for their well-being was learning competence, education skills, and employability to be able to thrive. And the second one was, of course, good health and optimum nutrition. The others featured a little bit in terms of safety and supportive environment, agency and resilience, and about 4% for connectedness, positive values, and contribution to society. We used the findings of this particular survey to build the agenda for action for adolescents, which I'll mention was an advocacy tool that can be used to advocate for adolescent well-being. What we have done is the different asks of the agenda for action for adolescents. It has 7 key asks. So the different asks have then been plotted against the 5 key areas of investment: education and learning, nutrition, mental health, reducing child marriage, as well as violence and injury. And we are now tracking commitments against these particular topics as well as asks. This was a very short update on our program of work, and you can find more information on these links. I'm also happy to drop it in the chat, and also happy to answer any questions that anyone might have. Thank you.
Thank you. Excellent presentation and excellent work. Always pleasure to have our friends from WHO with us. Now, my pleasure to give floor to Dr. Roger Worthington, consultant in ethics and global health and co-chair HESI SDG Publishers Compact Fellow, former faculty Yale School of Medicine from London, United Kingdom, and to Dr. Colleen Kraft, Professor of Pediatrics at Children's Hospital, Los Angeles, California. She was also the president of American Academy of Pediatrics in 2018. Their focus of presentation is on education sustainability. Take it from here. Thank you, Roger and Colleen. Go ahead.
Thank you very much for that introduction, Rita, and welcome everyone. It's a pleasure to be here, and just
Your microphone is cutting off, Roger.
Building foundation to reduce really. I don't know. I can't. Can you hear me now?
Yes.
That's better, yes. Mm-hmm.
Okay, sorry about that. Well, we've already been introduced, so I'll skip that. So we're framing this in relation to the SDGs. I'm sure we're all familiar with this, but we're drilling down quite specifically and focusing on SDG 3 and 4, but even more specifically targets 3.1 and 2, which deal with reduced maternal mortality, and 3.2 for preventable deaths of infants and children under 5. And we're really interested in the connections between these and 4.1, which is about gender disparities in education and equal access across all populations. So this is the area that we want to discuss. A lot of these problems are to do with equity. And in our view, equity really has a foundational principle which underlies all the SDGs. And gender disparity remains a problem, more in some countries than others, but even so, we feel strongly that in order to reduce rates of infant and maternal mortality, women need better access to both health and education. So what does this mean in practice? What are the implications of this? Well, one thing is you clearly need a trained workforce and the facilities needed to provide essential care. It's no use having one without the other. But even if you've got a good health system, if the education system is not resilient, then that leaves challenges. So we think the education program is important right the way from the very earliest stages through to all the way through to professional education and training at graduate and postgraduate level. So the implications of that, our analysis, are that better policies are needed perhaps to address bias and discrimination against women and girls. And this may mean structural initiatives that are designed to address the social change that is needed to counter this bias that still persists in parts of the world. Professor Kraft will be giving some illustrations of these points shortly. So I'm just providing the framework here. So what steps are needed in order to provide these outcomes? And so one is prefaced on the other. So we've narrowed it down to these action points. So one is to address child marriage and rates of teen pregnancy, because there is strong evidence that these are contributing factors in relation to maternal and infant mortality. Now, the second point we want to emphasize is the importance of taking steps to reduce and eliminate bias against women, which runs deep in societies, sometimes right from the time a baby is born. Again, I'm going to rely on Colleen to illustrate these points. And the third point is that, as I said earlier, you need it's not just good enough to have the personnel, you need the infrastructure as well, and the education. Of course, this may require investment from outside agencies such as World Bank and other international agencies. And really, we do want to emphasize that it's important to link all these things together, because just taking these issues one at a time, we think will have limited effect. And sad to say that since the pandemic, looking at the UN report on the SDG goals and breaking it down according to the various targets, there has been some slippage. In other words, the attainment towards the 2030 agenda is actually going backwards in some areas. In some parts of it, there is significant progress. But in the areas that we're discussing, there is a big challenge. And so it will need both energy and commitment in order to address these problems and to see substantive change. So that's the framework and how we're connecting with the SDGs. And so it's now a great pleasure to hand over to Colleen, who will take over from me and provide the illustrations. So we're sticking with the same set of slides. Colleen.
Thank you so much for that introduction to this whole topic. And this is really wonderful, coming on the heels of the presentation from the World Health Organization on the adolescent voice, coming out and saying, this is what we need, this is what we want, because coming from that grassroots is so important in really making this happen and making it sustainable. What we know from the literature is that education, particularly of girls, globally affects all of these things: maternal and neonatal intrapartum death, improved child health, lower fertility rates, improved child nutrition, increased income potential, reduced risk of transmitting HIV/AIDS. Let's go on to the next slide. Can we do the next slide? Okay.
Oh, it's
there you go. Got it. Okay, we're good. If you think about this in terms of a logic model, and this is really based on a review of the literature, well, I'll go through some specific case studies, but over and over again, here is the logic model: maternal education, education of girls from primary school. And many countries do education in primary school, but then they don't give access to secondary school. What you'll find in the literature is that maternal education, women who have been educated from the time they were young through secondary school, improves their cognitive ability. It increases their autonomy, which is really vital for marriage and partner selection and healthcare decisions. And it increases employment and income. All of these things affect personal healthcare decisions. So women who are educated make better family planning and fertility decisions. They know about sexually transmitted infection protection with partners. They have improved attendance at antepartum visits. Many studies have shown education really translates into those prenatal important visits, which is really helpful in the outcome of the child. They know their options for delivery and know to deliver in a certified healthcare facility as opposed to home where there may be risks. And they know of their options for postpartum care. These personal healthcare decisions specifically move into child health outcomes. So their children have increased immunization rates. There's increased spacing between children. We know that these women know about child nutrition, and the selection of food for their children is improved. The recognition of when children need healthcare is improved, which again impacts child under 5 mortality and survival. And that these educated women will support the education of all of their children, not just their sons, but their sons and daughters. Next slide. What I'm going to do from here is to go into some, go ahead.
Showing,
Some specific
sorry,
examples.
my connection is slightly unstable at the moment.
Okay.
Yeah, I'm good. I'm sorry if there's a slight delay with the slides. It's just my connection
Okay.
is a little bit shaky today. But please, Karen, yeah, it's fine.
So I'm going to review some of the literature and some
Can
of the
you see
case
the next
studies
slide?
from this is fine from different countries. So in Burkina Faso, mothers with any secondary education, something beyond the primary education, are twice as likely to have their children in a healthcare facility compared to mothers with no education. And I like the way that this is put. An additional year of schooling for 1,000 women prevents 2 maternal deaths annually. Really very close translation. We can go on to the next slide. When you look at child survival, a child who's born to a mother who can read, that's primary education, is 50% more likely to survive to age 5 than a child who's born to a mother who cannot read. In Indonesia, vaccination rates for children are 19% when mothers have no education. And when mothers have secondary school education, that figure rises to 68%. Life-saving vaccines and access to children is directly related to maternal education. In Bangladesh and Indonesia, the odds of having a stunted child decreases 5% for every additional year of that mother's education, really speaking to understanding when that child is not eating well and those food choices that are important for child nutrition. Next slide. Looking at fertility. In Mali, it's been studied, women with secondary education or higher have an average of 3 children, and women with no education have an average of 7 children. In Guatemala, a 35-year study spanning a couple of different generations found that link between the years that girls spent in school and the timing of childbearing. So for each additional year that a young woman spent in school, the age at which she had her first child was delayed by approximately 6 to 10 months. Looking at more mature, older, more educated women for having children to really look at those child outcomes. Next slide. HIV/AIDS. Women in 32 countries who remained in school after primary school were 5 times more likely to know the basic facts about HIV than women who could not read and were not educated. And even some old data, the 2010 Education for All Global Monitoring Report in Malawi, only 27% of women without any education knew that HIV transmission could be reduced for their baby for taking drugs during pregnancy. But women with a secondary education, that number more than doubled. So these women knew that if they had HIV, they could prevent it in their baby by taking medications during pregnancy and delivery. Next slide. Again, in HIV/AIDS, A study in Zambia found that HIV spreads twice as fast among girls who do not have an education, and that each additional year of education for girls reduces their chances of contracting HIV by 6.7%. Again, we talk about getting rid of HIV in our world, and maternal and girl education has everything to do with this. Next slide. Increased income is really important for the whole concept of autonomy. And in Indonesia, a single year of primary school has been shown to increase women's wages later in life by 10 to 20%, while the returns on female secondary education are between 15% and 25%. And we know, you can move on to the next slide, but we know that women who are educated have more autonomy in terms of their partner selection, when they're having children, how many children they are having, and overall healthcare decisions. And then in Malawi and Tanzania and Zimbabwe, 11 years of maternal education significantly decreased that child stunting, wasting, and underweight. This is important because it suggests that more than primary education is needed for this increased health effect. Many nations will support primary education with girls, but that risk of child marriage often happens at the end of primary education. And so the data is showing us that secondary education is really important for increased child survival in many areas. Next slide. What's really fascinating with looking at the literature is looking at some of the difference between no education and any education, which is significant, and then primary versus secondary education. So child development and education in Uganda, maternal child dyads were studied, and 10 years of maternal education led to more maternal-child interactive activities, less corporal punishment, understanding child development and appropriate consequences for behavior, and then higher enrollment in preschool. And we know from many studies in the United States that those early years of preschool are really important in developing that lifelong trajectory for children. So I think that ends our formal education, and wanted to congratulate everyone here for steps you're already taking to improve its sustainability and really underscore the importance of education for all, particularly girls, and not only just in the primary years, but in the secondary years as well too. Thank you.
Well, thank you, Roger and Colleen. Excellent presentation and very eye-opening. And it complements, I'm sure, WHO's initiatives in adolescent health. Okay, now here comes our tech expert, Dr. Ganesh Mani, adjunct professor of innovation practice at Carnegie Mellon University in Pittsburgh, which is in USA, Pennsylvania. His focus today is on digital divide and what can be done. Go ahead, Ganesh.
Thank you, Rita, for that excellent introduction. And I thought, I'd cover some specific things relating to how data and AI can reduce digital divide and poverty. I'm at Carnegie Mellon, as Rita mentioned. I've also done some work with CMU Africa. My colleague Edith is going to be speaking about some things next. Seems like we're past the peak child effect, right? I think that's a term coined by Hans Rosling. Population is going to level off, but what we're going to see is still continued issues like homelessness. That's a chart of homelessness on the right-hand side. You can see there are countries like Nigeria, Pakistan, Egypt, where homelessness still runs about double digits. Which means some of those countries, population of 100 million means 10 million, 20 million plus homeless people compared to, for instance, India and China, which are at 1 billion people, only a few million, single-digit million now are homeless. So China and India have made a lot of progress, while some of these other countries still have a lot of work to do on the homelessness front. Digital divide, we can roughly carve that up into 3 pillars. What's the internet access? What's the speed of access? We just saw some, blips even on this presentation with respect to even developed countries. I think in the US, about 10%, mostly rural, have trouble with internet access and speeds. But if you look at, that's where the 90% on this left-hand chart for North America is. South Asia has pulled ahead a little bit, but Sub-Saharan Africa is still at about 30%. These numbers are a couple of years old, but you can see the trend increasing, but still well below 50% in terms of share of the population using the internet. And not only do you need access, you need facile access, which means speed if you're watching an educational video or if you're being instructed on a health protocol and so on. So you can see the darker areas on the bottom right hand are relatively medium to high speed, lighter areas are low speed. So speed is also an issue with respect to internet access. And then the overall infrastructure, right? It starts with electricity, starts with a tablet as opposed to just a smaller Android phone. And then the digital skills. If you have good internet access, are you then able to use it, or all family members able to use it, and so on. And there are some cross currents, right? Colleen, others have talked about sort of the gender differences, obviously gender, geography, demographics. We talked about education being important for both mortality and fertility, but these cross currents of demographics, gender, and geography are really important when we look at the digital divide as well. So percentage of the population that has African population with access to broadband actually increased from sort of the mid-20s to mid-30s. North Africa is doing better, north of 50%. And here is sort of a quote from the African Union Commissioner: to reap the benefits of digital transformation, you need low-cost connectivity, and then also infrastructural investments, but making sure that we pay attention to demography, gender, and geography, and so on. So affordability is one aspect, and then also the regulatory framework is important. In India, there are a couple of examples of free or near free data. Geo pioneered it. There are some business models like WHEC, which is taking unused internet from sort of the middle income rich folks and trying to sort of provide that to the lower income households, if you will. You can see this right chart, cost of 1 gigabyte of data. That's fallen dramatically, right? From roughly 250 rupees, which is about $3-4, down to cents in less than 10 years. But what do we see on the flip side? There are privacy issues, data harvesting. So nothing is free, even for all of us, right? We pay when we watch things use the internet. Either we're paying with our own data, or we're paying with dollars, or we're paying with our attention, right? So, and data for folks who are not very savvy leads to data harvesting, identity theft, human trafficking. So a lot of deleterious effects that come with free data. That's where the regulatory framework comes in. That's where more sort of this responsible use of data and AI comes in as well. Here is something we wrote up about sort of what's important in data science or AI project. There are 3 things to pay attention to. What is the data? Is it high quality? Does it need to be repaired? What's the domain knowledge? What are people going to do with it, right? And what are the tools? A lot of the tools are open sourced. we'll come to the digital public infrastructure in a second. The data and the domain knowledge needs to be regionalized. So if you're working in sub-Saharan Africa, you need to be dealing with data and the domain knowledge relative to that geography in a low resource language there. So it may have to be transmitted using sort of voice as opposed to text and so on. And digital public infrastructure, which folks like Gates Foundation are funding, turns out it is very interesting because much like the physical infrastructure, we don't have the tragedy of the commons. Digital infrastructure can be reused without loss of fidelity. Great use case is the India stack, started with payments and the unique identifier Aadhaar. Now it's being used for health applications. And we've seen it amongst the educated workforce like some of us, right? We started using Wikipedia, and now a lot of the AI models are being open sourced through Hugging Face. WhatsApp has been a revolution, even though it's privately owned. There are day laborers in Africa or Asia that are being called to duty at 8 or 9 a.m. They can report for work where it's available at 10 a.m. and have a livelihood for that day, if you will. So the digital public infrastructure is applicable to all the three domains: health, wealth, and wisdom. And I think there are some very interesting use cases. With respect to Africa, here is sort of an exhibit from BCG, vocational upskilling, job matching, and skill development. So I use that WhatsApp example. You want to make sure you push that alert to the right person with the right skills. If it's a construction job, then needs to be somebody skilled in masonry or bricklaying or whatever it might be. So how do you do that matching? There's a role for data and AI there. Higher education partnerships, CMU is doing something via the Afrotech network. The whole idea is how do you disseminate some of the best practices from sort of the top universities into the next level of universities in Africa, who in turn can then work with the K-12 centers of excellence with schools and so on. Because if we want the next generation to be more digitally savvy and the chasm to be narrow with respect to the digital divide, we've got to start at the K-12 stage, right? And I think climate resilience, now a lot of parts of Asia and even the West, it's too late, right? So as we build infrastructure, as we collect data in Africa, can you also pay attention from a forward-looking perspective to climate resilience, right? So first thing, we need high-quality data. There's paucity of good data. And then once you have good data and the right domain knowledge, you can build analytics, you can do the right planning, you can make the right decisions and so on. But that data infrastructure and also the domain knowledge needs to be written down. A lot of interesting things in Africa is the oral tradition. Knowledge has been passed on by storytelling, anecdotes, etc. It's not in written form, which means these large language models for low resource languages cannot be trained. You need to do that voice to text, then text to training using additional corpora and so on. So some very interesting things there. AI and UN SDGs, clearly there's a nexus. AI can and data can benefit multiple SDGs. And as you all know, all the SDGs are sort of related. I think we're focusing on maybe goal 1, reducing poverty, but it relates to some of the other goals as well. And AI is not uniformly, it requires a lot of water, requires a lot of electricity, which can then further exacerbate the digital divide, right? So this is some work by Ricardo Vinuesa. Positive impacts preponderate over the negative impacts, but we need to pay attention to, again, how it's being used, why it's being used, in some cases, a simpler technique rather than sort of a more complex AI technique, maybe apropos. Case study from some folks at Berkeley. Emily Eichen guest lectured in my class and I think visited CMU Africa. My colleague and next speaker, Edith, knows her. So what they did around the stimulus payments, some of the census data tends to be very old, sometimes over a decade old. But Togo said, if you want to target aid to the right household and to the right people within the household? Can we use remote sensing? So using satellite data, can you look at the poor neighborhoods? So they'll have unpaved or kacha roads, as we say in India. The roof may give you some hints as to sort of the poor neighborhoods. And then within those neighborhoods, you may want to target the right folks. So can you use sort of phone data, metadata on the phone can imply that folks are sharing a phone in a household, which again points to an impoverished household and so on. So then they were able to transmit the payments using a payment to phone methodology and so on. So some very interesting case study relative to that. We wrote up something about sort of AI grand challenges, and we came up with this sort of mantra, right? What's the responsible use of the people, by the people, with machines, for the people, if you will. There are a number of challenges that have been solved. Accident avoiding car is sort of an interesting one where we are halfway there. We're mixing humans with autonomous driving. That's part of the problem. If you get rid of humans in certain geographies, I think self-driving today will work very well. Facile translation. So there are a number of agents using data and AI for transmitting benefits, for transmitting job opportunities and so on. So I think agents are something AI could help in, which lives on your phone, alerts you to the right opportunity and so on. That's sort of what we think about as application for this decade. That is actually the end of my presentation. I think Edith is going to lead with some of the health applications in East Africa, I believe. Thank you for the opportunity, Rita, and thanks for listening, folks.
Oh, thank you. Thank you very much, Ganesh. It was very eye-opening. Now the next speaker is Dr. Edith Luhanga, Assistant Research Professor at Carnegie Mellon University in Rwanda, Africa. She was a lecturer at Nelson Mandela African Institution of Science and Technology in Kigali, Rwanda, and she's going to tell you some knowledgeable, practical issues of Africa. Go ahead.
Thank you so much, Rita, for the introduction. Let me just share my slides. Okay, I hope everybody is able to see my slides. So Ganesh has already mentioned a lot of issues around the digital divide, and I want to take this opportunity to speak a bit more about the digital divide in a different context, the context of access to information itself. So these are recent statistics, still a year old. More than half of the internet content is written in English, which means there's very limited opportunities to develop AI applications that can bring the sort of transformation that Ganesh has been talking about, and some of the applications that I will be talking about here in health. But in this talk, I want to open up your imagination to some of the questions we have an opportunity to explore because of the recent advancements in AI. So we have more than half the content on the internet in English. None of the African languages feature in the top 20 content in the internet. And so some of the research I've been doing over the past few years has been around maternal health. In 2021, with a student in Tanzania, we tried to develop a pregnancy complications prediction app. So this would be something that would look at conditions that are prevalent in the Tanzanian context, things like malaria in pregnancy, and just use the wealth of data available on the internet to help women input their symptoms and predict when they're at risk for these complications so they could seek early health care. Challenge was, we found the resources to develop the AI model to a very high prediction rate, but the resources we found, even the ones that were from Tanzania, were written in English, which means the resulting application, you can see a prototype here, was in English. So it wasn't very useful for the women we were developing for, the majority of whom spoke Kiswahili. And so the wealth of information that we have online, the wealth of health apps, we now have an estimated up to 350,000 health apps over 70,000 health websites remain largely inaccessible to a lot of the global population. So this is another aspect of the digital divide. But despite this, we see huge numbers using these applications. So the top 5 health websites in the world, they each have around 100 to 300 million visits a month. Majority of this, yes, is from the global north, but we have quite a sizable population coming from the global south. And most of these people are finding these websites through search engines. So for example, 70,000 queries around health are made every minute on Google. And we are seeing also a diversity in the type of searches that people are making. We're not just seeing people writing text as we used to. We're now seeing people also using voice engines to search. So there's more people, those with visual disabilities, those who might not have the highest literacy, who are now able to search and get access to this wealth of information, which still remains in English and largely inaccessible. But it's important for us to make this information accessible, because if you look across any of the Sustainable Development Goals, you'll see there's an aspect of behavior change to it. So Roger and Colleen talked about maternal mortality, and reducing maternal mortality for the Rwandan Tanzanian context would require reducing things like sepsis, which is preventable with the right knowledge, knowing what to do, but also with the right attitude. Why should I do that? The right skill sets, how should I do that? And the right supportive environment. And we're now seeing a wealth of applications online that can address all these different aspects of behavior change. So I have some examples here. If you've ever checked your symptoms online, you've probably come across the WebMD symptoms checker. It was one of the first symptoms checkers which would diagnose you. But now we're seeing ChatGPT, which is outperforming WebMD. We're seeing studies that are able to predict who will need an emergency room based on their search queries. All this impact people's knowledge, and that might get them to seek care earlier. We have applications that look at things like virtual coaching, using chatbots and just interactive virtual agents to change people's attitudes and skill sets. But we're also seeing more research around creating a more enabling supportive environment. So I mentioned 20% of Google searches are now on voice, but the majority of the internet content was developed at a time when people were expected to read, not to listen. And so we're seeing research now that's looking at how do we change that web content to be more accessible in an audio format. Given this wealth of applications and how tough behavior change is, it's obvious why people want to use these applications. And just in case we need more evidence that we need to enable people who don't really speak English to access these applications, here are 2 studies. The second one is one that I did again in Tanzania, which shows that people who speak English as a second language often can access these resources to an extent, but they come with negative health information seeking experiences. In our study, for example, the one on the bottom, we had a woman who was able to get online and search for health information, but she couldn't find the right terms to express her symptoms, and therefore she ended up with irrelevant results. Now, it's not all doom and gloom. We do need more content that is accessible to people in their native languages to be able to come up with the health applications and other applications that are AI-based. And there have been initiatives to improve access to these resources in recent times. So currently, a lot of governments in the global north are making health information available in multiple languages. This is the Medline Plus website, where some of the content is also available in Kiswahili, which is the main language spoken in Tanzania. But we're also seeing initiatives by the private sector as well. We have Google, which has now added multiple languages, African languages, to its Google Translate, as well as its Gboard apps. And so people can now search in languages like Swahili, which is spoken by a lot of people, but even in languages that are spoken by a lesser number of people, languages like Kenya-Rwanda, which is common here in Rwanda. So we have an opportunity now to build applications, these AI-based applications that can be accessible to a lot of people. But there's some questions I feel we need to explore first before we get there. The first would be, what use cases are most useful and acceptable for different groups? So I showed you some of the research we started working on in 2021 around predicting maternal complications. And some of the challenges we realized is that sometimes there is a tension that can come across when patients are searching for information online, and that differs from the information that they get from their doctors. It can create a tension in terms of the relationship between the patient and the care provider. So what use cases would be useful and acceptable by the different parties that are involved in healthcare? But some other challenges we experienced is we aimed to address this question by using participatory design. So where you sit down with the different stakeholders and try to come up with concepts for what applications should look like. But then when you have people who do not have the AI literacy, it's difficult to explain what the technology will look like. A lot of the times you almost have to develop something and then show them how it works and then start the discussion process. AI development can take time and it takes a lot of data. It takes a lot of computational resources. So some of the questions we have an opportunity to try and address is how do we rapidly identify and develop these AI-based use cases so that we're able to have better interactions with people without the right background in AI literacy. But also, how can we improve human and AI interactions in general for different cultures and contexts? A prediction error from an AI engine might be interpreted differently depending on people's cultural contexts. So how do we explore and address these when we're developing these tools? Two other questions I have is, first, we have this new multilingual resources, but there hasn't been a lot of research from the developer's perspective of how useful these resources are in enabling them to create some of these AI tools that will have been identified, hopefully, when we answer question number 1. And so we also, because we don't know how useful these available resources are, we also need to look at what additional resources might we need. Do we need better tools? Do we need better computational power? And what we have now is enough? These are areas I would say are a call to action from me. And this is an area I'm actively working on, and I look forward to collaborating with anyone who is interested in exploring these questions with me in the African context. So that's the end of my talk. Thank you very much.
Thank you, Edith. And hopefully we'll see you again in other side events, especially focusing on AI. Next speaker is our Upasana Chauhan and Lucky Gill. Both are NGO representatives at the United Nations from Women's Health and Education Center. Their work in India on ending child marriage is remarkable. Yes, in 2024, child marriages do happen. And unfortunately, my country, India, is leading the way in this. Sorry to say that, but hope you find it intriguing and support these efforts. Go ahead, Upasana and Lucky.
Hi, everybody. Let me just quickly share my screen. Somehow I'm not able to share my screen. Lucky, do you mind sharing your screen?
Yep.
Good.
Is it there?
Yeah.
Yep.
Yeah, I can. Thanks, Lucky. Thanks, everybody, for amazing presentations. And Edith, I agree. I could personally relate to your a lot of information there, because a lot of women, they do have access to technologies, but since the local languages are different or the education is also like partial, they are still not able to access the amazing health information online. So thanks so much for sharing that information. And so as you guys know, my name is Upasana, and I'll be joining this presentation with Lucky today on child marriages. And as Rita rightly mentioned, that yes, we still do have child marriage as one of the major problems in India, but my presentation is also not about just India, that we need to what happens is whenever we discuss about child marriages, we often tend to think that this is a third world country problem, but we always the most important point to notice is that's not really a third world country problem only, and it's the same problem in developed countries as well. Here's a picture of me and Lucky with a lot of our colleagues at CSW and from Zile, just saying hi to everybody. So next slide, please. So if you see, right, child marriages are, we know that child marriages happen to girls, of course, but it's also a case that there are a lot of men, a lot of young boys also who are a part of child marriage, unfortunately, as well. So 86% of minor girls and 14% of minor boys are. So child marriage is much more likely to happen to girls than to boys, and child marriage defined as we all know is a marriage before the age of 18 and applicable for both boys and girls. But of course, the practice is more common among young girls. And between 2011 and 2020, more than 140 million girls will become the child brides, according to UNFPA. And the numbers are still growing. And if current levels of child marriages hold, 14.2 million girls annually or 39,000 daily will marry too young. So furthermore, of the 140 million girls who will marry before the age of 18, 50 million will be under the age of 15, 50 million girls. So despite the fact that 158 countries have changed the legal age of marriage at 18 years, the laws, as we all know, are rarely enforced. Practice of marrying young children is upheld by traditional and social norms. This is how it happens in our society. That's how it happens in our generation. That's how it happened to our mothers and grandmothers. And that's the traditional societal norm that keeps on continuing. And according to UN, complications from pregnancy and childbirth are the leading causes of death for girls aged 15 to 19 years in developing countries. And of the 16 million adolescent girls who give birth every year, about 90% are already married. So UNICEF estimates that some 50,000 girls unfortunately die, almost all in low and middle income countries. Stillbirth and newborn deaths are 50% higher among mothers under the age of 20. So, and one of the reasons is that we know that poor families, when we hear about poor families, or when we read about poor families, we cannot even comprehend or imagine what level of poor are we discussing here. But it's really, they have to decide every night who is going to eat, because the number of heads are more than the number of meals available for them to eat. That's one of the major reasons, and especially in poor communities, that they have to get their children married early on so that their child can eat. One of the most strangest reasons and the saddest reasons that I came across while my work, but it's true. So in major cultures, also a major incentive is the price perspective that husbands will have to pay for the young brides. So, men are paying money for young bride. The poor families need money. It's very unfortunate, but it happens. And societal pressures within a community can lead families to wed young children, like I just mentioned. And some cultures believe marrying girls before they reach puberty will bring blessings on families, one of the superstitions again. And some societies believe that early marriage will protect young girls from sexual attacks and violence. And girls are married young so that they don't become pregnant out of wedlock and bring dishonor to the family, is also one of the very weird reasons. Nearly all the children married recently were age 16 or 70, typically too young to leave home or enter a domestic violence shelter or file for divorce, even if a marriage turns abusive. So we have to understand that this is not just a South Asian issue or an issue for third world countries or developing countries. When I was working with the New York City CEDAW law for New York City as well, it was back in 2016. We were really shocked to see that in New York City at that point of time, child marriage was legal. And I was very, very shocked because I just came from India and I thought this is just an Indian problem, but no. And then I met few people who also were part of child marriage, or whose family members were also part of child marriages. So we need to understand that when we refer to child marriages, we often look at this as a third world country problem. However, this is very much of a problem even in the most developed and advanced countries and societies. Nearly 300,000 minors, the vast majority of them girls, were legally married in the United States between 2000 and 2018, according to a 2021 study. So we would assume that the most developed country in the world will obviously not have child marriage legal. And however, it was only in 2017, very recently, that the child marriage age was increased in New York State from 14 to 18. But there was a loophole. The loophole is that with parental and judicial consent, 17-year-olds can still marry. So it's still as big of a problem in US, in New York City, or in New York State, and even there are other states like California. They still don't even have any upper limit or any lower limit to get for marriage. So it's still much of a problem in other states, also within US as well. So if we are not addressing the child marriage problem correctly, of course, sustainable development goals will not be met. And education is one of the main key factor why we are again and again circling in this loop. Most of the girls who are into this, who are getting married early, are because they do not have access to education, irrespective of developing country or developed country. Again, it's basically that the girls do not have access to education, so they do not have a future for themselves. They cannot be financially independent. They're not aware of the opportunities that they can have once they have access to education, and they can actually break out from this chain of their families. So girls also, they don't know that if they can instead of using their time to earn money. Yes, I understand that at that time, because they have to bring food to the table, they have to work, which is an unfortunate thing in life. They have to choose between food and education. But there are several free government programs as well in developing as well as developed countries, which girls can enroll, maybe take short courses or something like that. But those education access to education is very much important. Unfortunately, there are a lot of policies and there are a lot of programs, and governments are also trying to do a lot of efforts, but the implementation is the key, and I feel that implementation is not happening properly. The girls who actually need access to education, we are not reaching there. Whether it's UN, whether it's the governments, irrespectively, we are not. So education is the key to end this cycle and break the chains. So it's really important that we educate our girls, and that's the only way to empower our nations. And here I am introducing you to my long-time friend and my partner here, Lucky. I'm not sure if you guys know, but Lucky is also one of the child brides, unfortunately, and I still get goosebumps always talking about her. I don't know whether I will ever not get them. She was 15 years old when she got married, and look at this picture of her. This is her wedding dress, and she's trying to look at these girls who are trying to go to school, but she was married at that young age instead of going to school. But I'm very, 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 very proud of her, because she made a beautiful choice of her life, and her daughter is a lawyer today, working with one of the top firms and in Vancouver, and she's also a very successful woman. So these are the stories that we need to highlight and feature and discuss, that how a child bride can shape her future really. And she has her own organization. She's founder of Global Girls Power, which is in partnership with WHE. So the floor is yours, Lucky.
Thank you, Pasna. That was great. And the numbers that you have shared are they will forever remain scary. And to me, it was not the numbers. I was one of those numbers. And as you mentioned, I am from Vancouver. I am honored to work with Rita Ji and also founder of Global Grow Power, where we believe in the education and empowerment of women and girls through leadership training, mentorship support, and all different projects and partnerships, which we are doing. And today is one such partnership. And I do work closely with Girls Not Brides organization as well throughout my career. And as Upasana said, yes, sometimes these are some of the stories, and I do take my story to empower me and inspire me every single day. However, I still get goosebumps, Upasana, every time I visit and look at those pictures. And yes, I was 15 years and 11 months old when I got married. And I was a daughter of a teacher who was a teacher for 39 years. And when we do see the reasons why girls get married, if it's the education, no, my mom was educated. What was not educated was my society was not educated. And the societal pressure was there. We were 4 daughters, and the burden, as the girls are looked at as a burden, in the boys are like more something that parents want more boys than girls. So girls are, so I always kind of said I was the third unwanted daughter, then came the fourth, then came the son, and then came my marriage. And they say the life is what we make out of it. So here I am, I think years later. It was ironic that back in 2017, it was actually the day that I got married, March 14. And that's the day I had stepped my foot into United Nations. And that's the day I think I broke down into tears, that a little girl back at home who didn't have any support and somehow survived countless miscarriages. Depression was one big thing for me, which I had survived. And I lived through, when I read the data, I lived through a lot of it. And the only thing that has happened differently, or I think that's a very small percentage, as Rita said, is that my marriage survived. That's the only thing. And I think education played a huge role. My in-laws allowed me to study. Again, see the word using allowed. They allowed me to study. So when I studied, education opened the doors to me, and that's what brought me here today. And again, as Rita has mentioned, that yes, I do come from a country. I won't say talk a lot about the data, but it's 1 in 3 of the world's child brides live in India. And I also come from north of India, which is one of the leading states as well. And if you look down here, the India's first introduced its laws against child marriage in 1929. And irony is that finally, when they set the age to 18, that was 1978, and that's when I was born. But nobody really cared, right? And
Lucky, I
yeah,
hate to stop you, but we are running out of time. Can you condense it, please?
I'm going to condense it really quickly. This chart quickly shows you that how this is India, and these are the next 10 countries, and these are remaining 192 countries. And Upasana's already mentioned tradition, culture, poverty, gender inequality, and lack of education are the main reasons. And devastating end of childhood, I've already mentioned with my example. And yes, the girls need to study and do not marry them off. And anytime I look at this was my age to go to school, not to put this bridal dress on. So if we want to achieve the sustainable development goals, we have to not only address quality education, but also end poverty and to achieve gender equality. I think all these goals play a role together. And one of the most effective ways to push back on child marriages is to push forward on access to safe, quality education for the girls. And this is some of the data. It kind of shows that it shows you that the girls that are educated, where they are, and the ones that are not educated. But the one big one, I think somebody else also mentioned that if all girls were to complete secondary school, the level of child marriage would drastically fall by almost 66%. And Malala had also said, one child, one teacher, one book, one pen can change the world. And I deeply believe in that. And I'm going to end I've got 2-3 more slides to go. It's basically educating a girl for a better world, and how we can achieve basically empowering, educating, promoting gender equality, encouraging supportive laws, and child protection policies, and also providing support for the development of adolescent girls. And this was my case. I would say also educating the society as well, not just the girl child, and educating the parents. And another thing that's happening is people don't report the child marriages, and also birth certificates are often made fake. I can talk about it in my cases as well. And just don't be part of any event that's promoting child marriages. And lastly, despite significant progress, we need to go almost 20 times faster to end child marriages by 2030. And that's what a new data shows, and it's estimated that it may take almost 300 years at the current rate to eliminate child marriage. And I would say that my last slide, I'm going to end with a motto from my organization, Global Girl Power, that when a woman is empowered with support and education, she is then able to recognize the brilliant potential within her and become the light of the entire community. She is more likely to stand against violence, earn a greater living, have a healthier family, support others in her community, and continue to surge that girl power, because I believe together we are stronger. Thank you, everybody.
Thank you very much. Now comes Dr. Donna Jenny, an additional NGO representative of Women's Health and Education Center to UN. She's a licensed therapist and today is focusing on preparing children for learning success. Go ahead, Donna.
Well, good morning from the snowy state of Massachusetts. I hope you're as interested as I am in what data-driven research has to offer about how best to prepare adolescents for a successful future. It begins in the womb, in the home, in the school, and in the community. But today's students earning a high school diploma is only the beginning. The real test of preparation is whether they can master the skills and knowledge they'll need to face the challenges of life after graduating. But first, some important data from the schools, parents, and community. I don't think there's anyone more qualified to speak about keeping children safe so they can concentrate on learning than Springfield, Massachusetts Police Superintendent Cheryl Clapprood, who reports that for 2023, we had 245,885 calls for service. The statistics for the department demonstrate that we are a mirror of the community we serve. And police officers, which will graduate in January, are 3% white males, 4% white females, 43% Hispanic males, 14% Hispanic females, 32% Black males, and 4% Black females. Superintendent Clapprood continues, the key to adolescent success begins at a much younger age than ever before. One reason is that we're seeing parents refusing to discipline their children, diverting responsibility away from their child's actions, and in turn, blaming others. What is lacking now is teaching children responsibility and accountability, all qualities embodied in teaching emotional intelligence. What we saw in our city last year was a 141% increase in car thefts. The suspects are all mostly 12 to 16-year-olds, and it was due to a TikTok challenge, which included stealing Hyundais and Kias simply by breaking into a car, smashing a steering column with a screwdriver, using a USB cable to start the car, and recording it for social media. While we used to focus on 12 to 17-year-olds for adolescent success, we now need to shift our focus to 8 to 12-year-olds because before they cross a line they cannot return from. Mentors, from teachers to police, need to develop positive relationships with these children at a very young age and then continue that relationship throughout their teenage years. And the difficult part is doing so without disappointing them, and that can help ensure adolescent success. Next, I don't think there's anyone more qualified to speak about what schools need to do to prepare students for the goal of what we want our students to know and be able to do than when they graduate than Superintendent Daniel J. Warwick, a veteran teacher, administrator, parent, and community engagement leader whose pioneer portrait of a graduate begins with the premise, the game begins and ends with pre-kindergarten. An expansion of community-based internships and financial literacy courses are but two of the career-oriented courses that Portrait of a Graduate features. Students should advance based on mastery of skills and knowledge. I believe Superintendent Warwick speaks as a true believer of universal preschool as the best foundation for preparing children for educational success. And I don't think there's any person more qualified to speak about what a city needs for an adolescent to be a successful learner than Springfield's awe-inspiring and exemplary mayor, Dominic J. Sarno. This is a team effort, he says, and we would not be successful without the help and partnership from the parents and guardians. Through these efforts, we give our parents and guardians the tools needed for our youth and students to thrive in a nurturing educational environment. Together and under the leadership of Superintendent Dan Warwick, we have seen a major increase from an unacceptable, barely over 50% high school graduation rate to now at a whopping 86%. And a dropout rate that was nearly 14% has been now lowered to 3.6. We will continue to involve families in our communities, seeking their involvement and feedback as we look to make sure every student has the opportunities to succeed and excel. It truly takes a village to set forth these successful initiatives. We will continue to press forward with educational and workforce development initiatives to show that a zip code will not dictate our students' futures. They will dictate their own futures. As examples of strategies to accomplish these goals, future United Nations presentations designed to meet the 2030 UN goals will include partnerships with Springfield's Hope for Children and Families Foundation, Springfield's Empowerment Zone Exemplary and Game-Changing School, Emergence Academy, and a focus on strategies from Bay Path University's Inspirational and Motivational Women's Leadership Conference. Thank you so much for being here today and for hearing our stories.
Thank you, Donna. And you can close your screen now, Donna. Any last minute comments from anybody?
No, just that it's interesting how all the other presentations connect, so well. And there's a consistent theme coming through here, and it's wonderful to hear that brought out and emphasized, through the different presentations. But I think we're all singing from the same sheet, really, in terms of emphasizing the goals and the need for more progress. So